and I will definitely start presenting dedicated dentist of the day to speak on the role of botanicals in dental care. Organized by PA College of Pharmacy, which is led by none other than dynamic Dr. Salimullah Khan, who is both a good reputed scholar and an excellent administrator. We also have Dr. Kaushik, who is the dynamic youthful president of KRPA, which is taking a lot of leaps of faith and going forward. In fact, I would like to say that Dr. Kaushik is basically a leap of faith person. He is an entrepreneur and he is always having his gut instincts to take him along. Congratulations on all your achievements. And we have, of course, Dr. Meenakshi S, who is, I'm going to say here, currently as a prosthodontist, a very skilled lady, but there are so many more dimensions of madam to say that I will go ahead. And yes, today's the topic is role of botanicals in dental care. And by the way, I'm Sunil Chiplunkar with Group Pharmaceuticals, and it's a happy moment for me to be the onboarding speaker. Let us see a few words about PA College of Pharmacy. Oh, what a fantastic building, white, glistening, excellent campus. Well, PA College of Pharmacy is at the hub of educational activities, and that is Mangalore, which is a budding institute of pharmaceutical sciences on a lush green 60-acre campus. And this group, the PACE group as it is known as, has the College of Engineering and the Pharmacy College too. The Pharmacy College has all the affiliations and approvals, currently running on B.Pharm and D.Pharm courses, and very impressive dedicated staff infrastructure, which is headed by Dr. P.A. Ibrahim Haji as the chairman, who has a number of reputed educational institutions in India and abroad. Obviously, the PACE group is encouraging excellence and diversity in thoughts and endeavors. Currently, they have 11 educational institutions under the PACE umbrella with 1,200 teaching staff and 500 non-teaching staff and a fabulous 20,000 students from 25 nationalities. Congratulations, Dr. Salimullah Khan, sir. And the PA Education Trust, established in 1999, is led by the renowned philanthropist. Today's main speaker is Dr. Meenakshi. Dr. Meenakshi is not just a prosthodontist, she is not just a teacher, but also an excellent speaker who keeps her listeners captivated, and also a superb researcher. So she wears many caps. And the best description that I like about her is she is an effervescent, eternal learner. I think teachers have to be constant learners, and that is when they start not only gaining knowledge, but love to spread knowledge. And one interesting dimension about her is she is very enthusiastic. Lot of emotional energy which she puts into research through scientific publications in international and national index journals. She has represented JSSAHER in various scientific deliberations. She has participated in various research workshops, and she has completed an ergonomics course too. This multifaceted persona, Dr. Meenakshi, has a diploma in nutrition from the Shaw Academy so that she can give better guidelines to geriatric patients, because prosthodontics normally deals with the geriatric patients. And she is part of the dental ergonomic team, so where they focus on helping students, understand that ergonomics is very important. So that's a separate subject altogether. And she has completed her PhD. Forget about BDS and MDS, which is a tall achievement. But besides that, she has done her PhD, and under a DBT research grant, she has done her PhD for the antifungal activity of a polyherbal. She is also as a co-PI for ICMR funded research topic, and she has to her credit ICMR approved projects also. As you can observe, she is currently involved in a longitudinal cohort study. So the prosthodontist basically is dealing with replacing the teeth, restoring the oral function, and it's also dealing with dentures, where a lot of problems are there with dentures. One issue is denture breath, which is bad breath, and that's due to the biofilms which happen in the denture also. So this halitosis or bad breath can lead to a lot of social problems, and at the same time leads to infection and also tonsil stones. So denture hygiene is very important. And some of the problems which you can see here, the photographs are shown, the oral thrush or a fungal infection. There could also be candidiasis. There is also denture-induced stomatitis, traumatic ulcer that happens, angular cheilitis, that is the cracks that happen at the corner of the lips, irritation, fibroma. So there are a lot of issues with denture. So it's very essential to practice denture hygiene. But what about the denture hygiene knowledge, attitude, and practices? Well, there was this survey conducted on 142 BDS practicing dentists. And unfortunately, many of the dentists did not associate the oral biofilms on the complete denture. So basically, the conclusion was that even dentists have sometimes limited knowledge on denture cleansing materials and denture hygiene importance. And there was a survey on patients who wear dentures. And in this self-administered questionnaire, they came to know that nearly half of the subjects clean their dentures daily once, but 50% did not clean. So basically, the dentures were rated as poor. So obviously, there is a very important requirement for improvement of denture hygiene practice. And since now the toothlessness in the aged or edentulousness is also increasing, and knowing that it can cause a lot of complications, it is important for us to ensure that the denture wearer uses various types of denture hygiene practices and products. Because another issue is that the dry mouth condition complicates the problem, and the hyposalivation further creates an issue for the denture wearer. So considering all this, Group Pharma has introduced a very interesting product which is called Densive with a patented color changing technology. The point is we need to encourage denture wearers with denture hygiene practice, and the product which is used for denture cleaning should not damage the dentures. So all these points are met with the help of Densive. Densive has got sodium perborate and PMPS technology. Together there is a synergistic reaction to generate the active oxygen, and this provides the aseptic dentures, and thereby the denture infection and denture breath is well taken care. So Densive is a very interesting product, and it is very easy to use too. So when the patient takes a tablet of Densive, puts it in warm water for about 15 minutes along with the denture, first you will see the color of the water changing to green in 5 minutes, and in 15 minutes it turns blue. When it turns blue, blue is fine. So it means the denture has got its cleaned action as well as become aseptic. What an interesting, excellent product for cleaning, anti-stain, and aseptic action. So obviously, doctors are in love with Densive, and so are the patients, and we are grateful to the doctors for providing a lovely, smiling set of patients with dentures. What a smile! Well, here you see Julia Roberts sporting an interesting smile. They have studied at the University of California, Mills College, the class photographs. Some of the girls were smiling with a genuine smile, Duchenne smile. They did an observational study, and for 30 years, they tracked these girls who were smiling. They found genuine smilers having happier lives in terms of marriage, well-being, and career. Just like we have Dr. Meenakshi Madam, who is a genuine smiler. So always make a confident Duchenne smile, a genuine smile which reaches up to your eyes, which you can see here, which is responsible for also the success of people such as Barack Obama. And here you can see a subject smiling. Do you think it is a Duchenne or a sure smile? No, this is not an authentic smile. It is called the typical air hostess smile. It is called the Pan Am smile. So people are giving you a smile, but it is not genuine. So be careful. Some of the smiles are not genuine. They attract you. But now let's come to the very interesting section. There will be 5 questions. So Dr. Kaushik is going to help me in this. And people have to answer the questions that I'm going to flash in the PowerPoint. Please get ready, all of you. And each winner will be eligible for a lovely gift hamper from Group Pharmaceuticals. Fastest finger first. The person who types the answer first will get the gift hamper. So this is only for attendees, not for the presenters. And here we start. Give the brand name of the protein subunit COVID-19 vaccine, which has been introduced by an Indian company. So the question is very clear. Some Indian company has launched a COVID-19 protein subunit vaccine. Give the brand name. Anybody in the attendees, please type in the chat section. Fastest finger first. Somebody has typed in the Q&A. No, it is Covaxin. No, answer is not Covaxin. Covishield. No, it is a protein subunit vaccine. Please see the question clearly. All are guessing Covaxin, Covishield, and I am not accepting the answers. Please give the correct answer with respect, and please type it in the chat section. Don't type it in the Q&A section, please. Please type only in the chat section. We can't accept all these answers. The question is very clear. There is a novel protein subunit COVID-19 vaccine introduced by an Indian company. So what is the name of that vaccine? Yes, it is a little tough in the sense you should be alert to all the goings on in the market. So are you aware? Are our attendees aware of this new vaccine? Yes, Corbevax is correct. Sharadi has given the first correct answer. Sharadi. So I am recording your name here. Sharadi, congratulations. You have answered this question first. So the answer is Corbevax. It is from Biological Events. Excellent answer to this question. Please answer the question only in the chat. Don't answer it in the Q&A. Okay, let's go to the next question. All of you get ready. Question number 2. It's a sitter. What is the natural form of aspirin? Aspirin comes from a biological source, and today Dr. Meenakshi is speaking on a biological active. So obviously this question is relevant. Please type the answer, attendees. The fastest finger first gets a lovely gift hamper. Sharadi has already booked his or her gift hamper. Now let us see the next person. The natural form of aspirin. Please type in the chat section. It is willow bark. Yes. Fatimat Nafia. Okay. So I'm taking your name. Fatimat Nafia. Congratulations. You have answered the willow bark first. So it is not Raulfia, it is willow bark. Very good. Lot of correct answers are pouring in, but the first person to register the correct answer was Fatima. Third question, which is the toughest natural substance of the human body? Which is the toughest natural substance of the human body? This question is dedicated to Dr. Meenakshi Madam and her profession. Which is the toughest natural substance of the human body? Please, enamel, yes. Asiyat Majida. I am taking down your name. Asiyat Majida. Congratulations. You are the third winner. Asiyat Majida has given the first correct answer. That is the enamel. Is it Asiyat? Just check. There is Maria Mat Ria also. Or is it? Please check, Kaushik, and just intimate me who is the first enamel.
Azia Masjid, sir, yes.
Yeah, okay, right. So let's go to the next one. Name the common fungus that causes infection in the mouth. Last but one question. Please give the name of the fungus that commonly causes infection in the mouth, especially for the immunocompromised or those who are suffering from hyposalivation. So they are having more vulnerability to this fungus. Candida, yes. Candida, I'll accept. Candida albicans is the full answer, but Rashmi has given the correct answer. So I will accept this answer from Rashmi. Congratulations, Rashmi. Now we'll proceed to the last question. Good, everybody is participating in a lovely manner. Best of luck for the last question now. Let us see. Name the proven popular herb that supports immunity in COVID-19 management. Okay, so this is the proven popular herb that supports immunity in COVID-19 management. Even the Ayush people have talked about this herb. So I'm very specific, I'm very clear that there is one herb that has been approved. No, it is not neem, I cannot accept it. Ashwagandha. Ashok, you are correct. Ashwagandha has been accepted as the immune support herb established and proven in COVID-19 management by Ayush. They are recommending ashwagandha. Yes, we accept that answer, and let's proceed. So, this is the intimation for all the winners. Please send your name, mobile number, and address with PIN code to these two email IDs. A very simple email ID, sunilchiplumkar@gmail.com and sunilchiplumkar@grouppharma.in. Please send your name, mobile number, and address with PIN code. So we will dispatch the gift to you. Congratulations and thank you for participating. Now we'll have the welcome remarks from Dr. Salimullah Khan, who is the principal of PA College of Pharmacy, Mangalore. After completing his MPharm and PhD with a total experience of 21 years, he has several publications to his credit in research journals, and he is a co-author to not one, not two, but 5 books. He has won the Best Poster Hearst Prize for the poster on chemical incompatibility studies, as you can observe here at Kottayam. He was also awarded the Young Investigator Award for Best Presentation at the International Conference on Pharmacology and Pharmaceutical Technology. Excellent feathers in the cap for this teacher, researcher, and administrator. So, congratulations, sir, on a very fine webinar that you have launched today. And over to Dr. Salimullah Khanji. Thank you very much.
Thank you, Dr. Chiplumkar, sir, for setting the stage for me. Before I formally welcome everyone here, I just want to say a few words. Already, PA College of Pharmacy, Dr. Chiplumkar, sir, has already explained and told many things about it. This college was started in 2018, and we are now in our first batch is in our 4th year, and we have been doing well all these years, and we have been participating in various activities which help the society. Basically, we are all pharmacists, and it's our prime duty to take care of healthcare profession, and we are all committed to uphold the values of healthcare profession, and that is what we are inculcating in our students, and we are doing it. And today's webinar is planned as a Society of Ethnopharmacology is a pioneer in restoring the traditional healthcare system and traditional practices. It is a branch or a chapter of International Society for Ethnopharmacology. The chapter is located in Kolkata, and we are proud to say that PA College of Pharmacy has bagged the Mangalore chapter, which is actively involved in carrying out various activities related to traditional systems and traditional practices. So, healthcare system, if you look at the worldwide, has their own traditional system anywhere in the country, anywhere in the world, everywhere you will see. And this system is it has been working since time immemorial. And most recent that we can recall is more than 3,500 years before the Christ. If you look at the Ayurvedic system of medicine, of course, the dates are not conclusive, but still some date is there that 3,500 BC is recorded at some point, and some point 1,500 BC is recorded. That is in India. If you look at the Chinese system of medicine, you have records of more than 2,500 years BC. If you recall Yellow Emperor of China, and Shan Nung of China. All these people have worked a lot in herbal remedies. And if you look at the papyrus abbas of Egypt, 1500 years before the Christ. So most of these traditional systems have been existing since time immemorial, we can say. And these traditional systems, apart from the structural systems like Ayurveda, Unani, Siddha, these are all more structural systems compared to the traditional practices. We have structural systems and also traditional practices. If you look at the tribes in India, there are a number of tribes like Chettigas, Irulas, Gonds, lots of tribes are there. Tribes have their own system of medicine. The Society of Ethnopharmacology is striving hard to bring these systems and validate these systems and bring forward and show it to the world there is another system existing which has time-tested medicine and which can cure a number of illnesses without causing much of side effects. Now, the word side effect is a lot of time confused with respect to the traditional system. We just think that anything from traditional system is safe, which is not true. Nothing is safe. But if it is taken in proper manner, in proper quantity, as per the prescription, it is safe. And the herbal system has the chemical constituents which are in very, very small concentration and which instead of directly acting by themselves, they in fact provoke the natural system of the body to heal any kind of disease. Right. If you look at the homeopathic system, it is very, very evident in homeopathic system. In homeopathic system, you have the least amount of the drug. It is diluted more than 25,000 times, which actually does not act by itself, but it provoke the internal immunity or internal healing system, whatever you call, from the body to heal your disease. Human body is made in such a beautiful way that human body, if you do not treat for any disease, it has the capacity to heal itself. Okay, of course, there are some diseases which definitely need external assistance for the curing, but most of the diseases, if you do not, you ask some Ayurvedic physicians, they tell if they have a fever or they have some digestion, what they do, they simply fast for 1 day, 2 days. Okay, if you fast for 1 day, 2 days, their disease will subside. Similarly, the body has the capacity to heal itself. So those healing powers of the body have to be activated, have to be provoked, have to be challenged. So the natural systems, many natural systems do this. Okay, and therefore the side effects generally we say are none, but not that is not true. There are many herbs which can kill you if you take in large amount. Like you have Gloriosa superba. There is a root of Gloriosa superba which is poisonous. If you take digitalis in large quantity, it is poisonous. Okay, if you take Naxomica, it is poisonous. So there are many poisons in the nature. That does not mean that all the herbal drugs are having side effects. So herbal drugs do not generally cause severe side effects, but we should not go blindly that it does not have side effects. So all these things have to be scientifically validated and brought forth to the world so that the world can appreciate it and make use of it, and it should benefit the humans. Okay, humans all over the world. It's not only for India or a particular tribe. So with this motto, the Society of Ethnopharmacology is working. So that chapter is there in our college and in Mangalore, and we are working on it. And as a part of that, I requested Dr. Sunil Chiplunkar that we are planning for that. Then Dr. Sunil Chiplunkar himself, Dr. Sunil Chiplunkar is such an active person that if you just ask him for one thing, he will bring so many things for you. Everything he does by himself. And what an enthusiastic person, what a dynamical leader he is. Thank you, sir. Before welcoming, I'm thanking you. Thank you so much for coming and helping us, giving a hand in organizing this webinar. Thank you very much. Now, to welcome, I would like to welcome the speaker of today's webinar, Dr. Meenakshi iyer, who is a prosthodontist, as Sunil Chiplunkar sir has already given a good, he has portrayed a good picture of Dr. Meenakshi. Dr. Meenakshi is from JSS Dental College, Mysuru, which is under JSS Academy of Higher Education and Research in Mysuru. Madam, I had been a part of JSS earlier in JSS Ooty. I worked from 2004 to 2007 when Dr. Suresh was our principal. Right, Madam, I wholeheartedly welcome you for this webinar, and I am sure our students and all the participants will definitely get benefited from your talk. And yes, as Sunil Chiplunkar sir was saying, there is a very good role of herbal drugs in dental practices, in denture. We also have worked a few things on dental practices, use of tulsi, use of garlic, ginger, and many such things for dental hygiene and dentures. Right. So I would like to wholeheartedly welcome on behalf of KRPA, on behalf of Group Pharma, on behalf of PA College of Pharmacy and Society for Ethnopharmacology Mangalore Chapter. Madam, I wholeheartedly welcome you for this webinar.
Thank you so much, sir. Indeed, it was.
I would like to welcome Dr. Kaushik Devraj, who is, as Sunil Chiplunkar sir rightly said, a very energetic, enthusiastic entrepreneur and a leader in his own right. And he has been actively participating in so many different activities, progressive activities, and he is doing a yeoman of a job. Dr. Devraj sir, hearty welcome to you on behalf of all of us here, PA College of Pharmacy, Society for Ethnopharmacology, and Group Pharma. I welcome you, sir. Dr. Sunil Chiplunkar, he is the Krishna of this webinar. He is doing everything on his own. I welcome you, sir, on behalf of Society for Ethnopharmacology Mangalore Chapter, PA College of Pharmacy, and KRPA. I welcome you wholeheartedly. Thank you so much for being with us all the time. I would like to welcome the staff of PA College of Pharmacy, who has been instrumental in bringing all these people, all these participants who are here. About the 268 participants are here. Most of them are our students. Thank you so much, dear staff, and welcome to you. I welcome all my participants, students for this webinar. I am sure you will get a lot of benefit from this webinar, and you will get a very good picture of what is natural, what are natural products, what are their role in healthcare system. Thank you so much, and over to you, Chiplunkar sir. Maybe Madam will speak. Thank you.
Thank you so much, sir. Thank you, sir.
Thank you very much, Madam. The floor is yours.
Thank you, sir.
Can start
Thank you so much,
the
sir. Yes, sir. Sure, sir. So are my slides visible to you?
Yes, madam.
Yes, ma'am. Yeah.
Yes. Am I audible, sir?
Super, ma'am. Yes. Yeah.
Okay. Okay. Thank you so much, sir. Thank you so much for this warm introduction of yours. And thank you so much, Sunil, sir, as well. So warm greetings from the heritage city, City of Palaces, Mysuru, JSS Dental College and Hospital, JS Academy of Higher Education and Research. So the topic for today's presentation is role of botanicals for dental care. So before I could start my topic per se, and Sunil sir made my work still more easier by introducing the specialty of mine. So we mainly deal with the Department of Prosthodontics, that is my specialization, where we actually care for replacing the lost structures at the same time maintaining what is actually existing. So we actually deal with the replacement of missing teeth and its associated structures with artificial substitute in the form of dentures, be it flexible dentures, be it full complement dentures or partial dentures, or in the form of implants, and restore back the patient's smile. So beginning with the topic per se, oral health is no different from the systemic health. And we should definitely think of our oral microbiota, which plays a very important role in maintaining the health as well as inducing the disease. So this development of oral microbiota mainly starts as a first inoculum in the newborn or in the infant, undergoes large amount of transmission and colonization in the early childhood with the development of deciduous teeth, often dominated by the pioneer species of microorganisms, undergoes a microbial succession in the adult and becomes increasingly diversified in case of elderly, especially geriatric population. And our oral cavity is an inhabitant of diverse microflora. Now, why does this happen is because we are mainly gathered by large amount of other parts within the oral cavity in the form of cheeks, lips, and palate, where there is continuous shedding or disformation of the epithelial cells, dominated by facultative anaerobes. The teeth, which is a non-shedding surface area, commonly concentrated by obligate anaerobes, and the tongue, which is a highly papillated surface, which has a mixed combination of anaerobes and facultative and obligate anaerobes. So when you just have a brief idea of flora of the normal healthy dentate mouth, so around 85% of it is mainly composed of gram-positive and gram-negative anaerobic rods. And the remainder percent mainly is formed by bacteria, fungi, protozoa, and a small concentration of viruses. So they're all opportunistic or the normal commensal flora, which could become opportunistic in future. A bird's eye view of what are the common microorganisms normally present in both the neonates and the adults. In the adults, it is mainly dominated by the bacteria, protozoa, and fungi, as Sunil sir was actually highlighting on the Candida species. So what happens to this oral flora with age? In the newborn, we actually see it is mainly colonized by facultative and aerobic organisms. And at 6 months duration, it becomes more complex with anaerobic organisms. With tooth eruption, complexity increases, enters into the gingival crevice as well. And in the adult, there is actually microbial succession or colonization of different species of bacteria. And with age, there is loss of teeth. And the mere loss of teeth is often dictated by giving artificial substitute in the form of dentures, which again becomes more challenging, where there is increased amount of colonization both in the oral cavity and on this artificial substitute in the form of dentures. There is also direct and indirect effect of aging, which could happen on the oral microflora. So there is internal factors as well as external factors, which could bring about some changes within the oral microbiota or oral microflora. So the friendly microorganisms could become pathogenic, could result in what is called as dysbiosis, resulting in immune dysregulation. So what it could actually lead is to periodontal diseases, oral mucosal diseases, and in the form of candidiasis. So you can actually see it is a bird's eye view of commonly seen oral mucosal conditions within the oral cavity. And Sunil sir has still made my work very easy by showcasing all these kind of oral diseases within the oral cavity. So there is also direct and indirect effects of aging, which could also happen on the oral microflora when the edentulous patients, when the patients have lost their teeth and have been rehabilitated in the form of artificial substitute, not only in the form of dentures, but also in the form of implants or crowns or bridges. So what could be the direct effects which could happen on the oral microflora is waning of cell-mediated immunity, changes in salivary antibodies, there could be hormonal changes, there could also be altered physiology of oral mucosa because there is some artificial substitute within the oral cavity. There could also be indirect effects in the form of denture wearing, because that itself is an artificial substitute present within the oral cavity. And of course, since there is loss of teeth, there could be dietary changes, and systemic complications could result in medication or antibiotic therapy among the geriatric people, which could also bring about some changes within the oral microflora as a result of aging. So with age, the oral mucosa becomes increasingly thin, smooth, edematous, more susceptible of various pathologic conditions in the form of candidal infections. And this dentures itself could serve as a reservoir in triggering a local microbial infection mediated inflammatory response. So when we have actually seen the microorganisms normally present within the oral cavity, we could also isolate some of the microorganisms from the dentures per se. So some of the microorganisms which could be isolated are gram-positive rot species, anaerobes, and bacterial species. And my area of interest would be in relation to Candida. This is a versatile pathogen, often commensal flora present within the oral cavity, which could become opportunistic, leading to large amount of fungal infections, especially in patients who are wearing dentures. So there is always formation of biofilm on the teeth because of presence of pioneer species which actually take place. So this pioneer species, if not taken care of, could be virulent and could result in large amount of diseases within the oral cavity in the form of gum diseases or periodontal diseases or loss of bone structures, resulting in loosening of teeth. And as I had a small chat with Salim sir, he's actually interested in biofilm, and here our interests meet. So I am actually interested in knowing some of the herbal or botanicals and its action on denture biofilm. So just like how we have biofilms formed on the hard structures, we do have biofilm formed on these artificial substitute in the form of dentures, and hence it forms a denture biofilm. So there is colonization of microorganisms, there is adhesion formed by colonization and increased maturation. And how this actually happens is it actually happens in the form of yeast cells, resulting in the formation of extracellular polymeric matrix and increase in quantification of this Candida organism. And how long does all this happen? It usually happens within 3 hours of placement of any artificial substitute within the oral cavity. And what is the beauty of this organism? The beauty of this biofilm, which mainly forms on the denture surface, the Candida not only infiltrates on the denture, it also infiltrates on the mucosa as well. So we have a mucosal biofilm as well as denture biofilm becoming more and more virulent. And what could be the sequelae of this biofilm, which mainly occurs on the oral mucosa as well as the dentures? It mainly triggers of an inflammatory condition which is called as Candida associated or Candida mediated denture stomatitis, often classified by Newton in 1962. Initially, it mainly forms as a form of pinpoint petechiae, diffuse erythema, and papillary hyperplasia. So what kind of denture stomatitis it is? It is a primary oral candidiasis chronic atrophic denture stomatitis, often goes unnoticed by patients. So when we think of mode of treatment, there are different mode of treatment targeting this oral mucosal biofilm as well as denture biofilm. So of late, apart from maintaining the normal precautions or the maintaining of denture hygiene, balancing the nutrition, giving tissue rest, as well as correcting the faulty dentures, we do have to sometimes administer some of the antifungal agents. So antifungal agents or antifungal drugs are commercially available in the form of azole derivatives, pollen derivatives, and triazole derivatives. So what would be the negative effect of having these antifungal drugs is decrease in success rate of treatment. So why is this happening? This is mainly happening because of the diverse resistance of this profile of Candida species. And sometimes there is also lack of patient compliance because of bitter taste which lingers within the oral cavity. So why is this resistance happening? So what could be the pathophysiology behind this? The mere presence of this antifungal drugs mainly targets the immune system within the body and hence reduces the neutrophil candidiacidal activity and increased proliferation of Candida because there are surplus nutrients present within the oral cavity, and hence there is increased proliferation. So how does this denture biofilm or oral biofilm mechanism actually happen and prevent the ingress of this antibiotics or antifungal drugs? It mainly happens by 3 mechanisms, that is physical tolerance, passive tolerance, and physiological tolerance by the Candida itself. So what is this physical tolerance is mainly by the presence of biofilm prevents the penetration of antimicrobials or antifungals within the target area. So that is your physical tolerance. So what could be the passive tolerance is mainly increased production of this extracellular polymeric matrix, which mainly acts as a barrier to prevent the ingress of antimicrobials or antifungals to the target site. At the same time, the presence of the cells itself would prevent the antimicrobials entering the target site. So that is your physiological tolerance. So there was a study done in 2012 to know what could be the main mechanism of this deregulation of antifungal drugs. That is mainly because of organisms acquired drug resistances because of transcriptional regulators of effector genes present within the Candida species per se. So can we think of a paradigm shift in the form of phytomedicines or botanicals apart from our allopathic or synthetic drugs? So these natural products are promising therapeutic alternatives, mainly because they tend to display much smaller and low intensity adverse reactions compared to our synthetic drugs or allopathic drugs, and hence can provide our health professionals with alternative, feasible, low-cost therapies of treating oral diseases. Apart from this, our natural products are enriched with large amount of secondary metabolites or phytochemicals to display its effect. So according to the World Health Organization, as many as 80% of the world's people depend on the traditional medicine. They're all patronizing the usage of Ayurvedic drugs or Ayurvedic type of medicines for their primary healthcare needs. And India has 15 agroclimatic zones and 17,000 to 18,000 species of flowering plants, of which 6,000 to 7,000 are estimated to have medicinal usage and often distributed in Hindustan Peninsula. So what could be the rationale for selecting of these herbs? There are approximately around 1,250 Indian medicinal plants, a very small number to name for the time being, which has been formulated as medicaments with beneficial measures, having antibacterial, antifungal, antiviral, antiseptic, and antioxidant properties, as said by Salim sir himself. But there is one important thing which many lacks, especially when it comes to oral cavity by itself, because any drug which is being developed has to be sustained within the oral cavity to display its effect. So inducing mucosal retention is the need of the hour. So when we come to the large amount of literature search in relation to natural products, and this was a survey done by us from 1966 to 2019, you can actually see the number of reviewed or the published papers, which has tremendously risen from 1966 to 2019, driving their interest towards natural products. And when you see the countries doing large amount of research on these phytomedicines, the Asia tops the list. So are these phytochemicals having anti-biofilm? Could they act as anti-biofilm agents? And the answer is yes. These phytochemicals or the phytomedicines can also be targeted in the form of anti-biofilm agents, as they interfere with the quorum sensing pathway and cell-to-cell signaling. They have good anti-adhesive properties to display its effect by blocking the adhesins often released by the Candida itself, acts as efflux and pump inhibitors, and it helps in dissolution of this extracellular polymeric matrix developed by the Candida species in the biofilm. The motility reduction by repressing the curly, pili, and flagellar genes present, as I said, the receptor genes, which could result in antifungal resistance. It could suppress that action as well, and reduced extracellular polymeric matrix production. So this is a quick bird's eye view of some of the plants and their active constituents, which could display large amount of antimicrobial activities. Some of the ethnobotanicals or the plant species, which has been played a major role in some of the oral diseases. Some of the plant species normally taken care in relation to our dental fraternity as well, to treat the dental decay, for tooth whitening, gingivitis, periodontitis, intracanal medication, and dental pain, and of course, bleeding gums. There are some of the preparations are also available for targeting the oral diseases in the form of capsules and powders, suspensions, and pastes. So as we got to know that there are different type of products which has been developed, which you actually know how to select the herbs for developing any kind of phytomedicines. With due respect to Salim sir, I would like to take a quick review on how we can select the plant material. So what could be the need and how you can actually select the plant material based on its botanical identification. And that actually leads to extraction of the materials, which ultimately needs to be standardized before you could develop a standardized extract. And of course, we cannot negate the importance of preclinical and toxicological assays, as sir said aptly, that not all herbs are safe. So it has to go through large amount of screening through preclinical analysis, and then only it results in the form of definitive formation, resulting in the form of phytomedicines. So all this could be directed towards ethno-guided or ethno-medical approach. So WHO has given certain guidelines for selection of medicinal plants for developing of phytomedicines. So the different approaches which you can actually select, first which could be the randomized approach. You can just randomly pick the area of interest and you can start analyzing, which is often the crude way, and you could often end up with not having the success rate. The second being ecological approach, depending upon your geographical location, you can select the plants and then you can do a preliminary screening analysis. The third being chemosystematic approach, where the chemicals you can target and the type of chemicals present within the herbs could be selected, and that could be taken care of in doing the further research. And which is my area of interest is ethno-guided or ethno-botanical approach or ethno-medicinal approach or ethnopharmacological approach, which mainly results in undertaking regional surveys of plants used in practice and mainly on people's or traditional medicine and having scientifically identifying them. The people's support should be there. Support the use of useful practices already in use, which is often selected by their efficacy and safety. And it also emphasizes the search for locally built knowledge among the traditional people regarding the natural resources and applications in the health systems. So as we all got to know that these herbs could be used and could be taken as safe, but sometimes drug formulation Ayurveda is also based on two very important principles. That is, it could be used as a single drug, or sometimes you can think of polyherbs, that is combination of drugs, to exert its desirable effect. Now, why do we have to think so? Even though the active phytoconstituents are present within the single drug, it could be present in very minute quantities, which could be insufficient to achieve the desired therapeutic benefit. Sometimes you can think of combining the herbs having the same therapeutic range, which could result in herb-to-herb interaction, resulting in herbs with phytoconstituents and could enhance therapeutic benefit when combined, when two important herbs could be combined. And hence, it is very important to know how the formulation is developed by following this P protocol, which includes the pharmacognostical approach, the physicochemical approach, and phytochemical approach. Very important in order to ensure the quality assurance of the developed phytomedicines. And once the quality is established, you need to ensure the efficacy and safety of these developed herbal medicines through definite amount of clinical evaluation, and where the regulatory practices will come into play, where you need to take ethical clearance, and ICMR guidelines for biomedical research against human participants has to be taken care of in order to take care of the efficacy and safety of these herbal drugs whenever you're before administering to patients. So when you're developing any phytomedicines, there are large amount of challenges encountered during the clinical translation from conceptualization to business model. And hence, you need to identify the need, you need to identify what kind of herbs you want to select, its design and fabrication. And hence, we as researchers and scientists should require a certain level of expertise in choosing our field of study, our area of interest. While scientists possess the knowledge of materials and their capabilities, it is our duty, ardent duty of clinicians who need to recognize the shortcomings within their respective fields. And hence, definitive collaborations are thus very important to yield discussions that cultivate innovative strategies for improving and enhancing patient care. As a result, material selection will play a vital role here, and because our oral cavity is a dynamic environment and hence requires a concerted effort from oral biologists in the unveiling of its intrinsic mechanisms or intricate mechanisms, since our oral cavity is very dynamic, often flooded with our biological fluid, which is saliva. And hence, sporadic thermal changes may also occur during mastication when ingested foods and liquids come in contact with these phytomedicines within the oral cavity. Hence, all these protocol has to be taken care of. Once having dealt with that, we need to carry forward with the design and fabrication of our phytomedicines, which is all laboratory oriented. Once the appropriate materials have been chosen for incorporation into a novel biomaterial, novel phytomedicine or drug delivery device within the oral cavity, now we as clinicians or scientists, along with collaborative efforts, must decide a suitable design and method of fabrication where the release pattern would be enhanced. They are not exempt from the complexities of the oral environment. Hence, oral environment is truly very dynamic, and all these parameters has to be taken care again. Multiple fabrication methods and technologies are available and has excelled over a period of years. And with this, we also have to take care of the laboratory studies, and we cannot negate the importance of the preliminary studies or preclinical studies before we can venture the definitive clinical trials. And hence, in vitro studies involving testing of a novel material following successful fabrication characterization plays a very important role. In vitro cytotoxicity tests are very crucial, and forms an essential component of biocompatibility screening, with several tests being used to ascertain the effect of a material on cell membrane integrity, cell growth, enzyme activity, or genetic expression. Then you can carry forward with what is called as clinical trials or in vivo studies. So in vivo studies are very crucial, and in a well-stimulated tissue environment, the researchers must strive to select and develop clinically appropriate animal models, if at all if it is required, or target the effective assays that will generate predictive data that closely correlates to the human disease, which in turn will streamline the process to clinical trials. So you can actually carry forward with some of the animal trials before you could actually enter into in vivo studies. Later, coming to the clinical trials, very important is to follow the good clinical practices whenever you carry forward the randomized clinical trial. So following successful in vitro and in vivo tests, being ex vivo or animal tests, that establish manufacturing standardization, efficacy and safety of an invention, ethical clearance is required for any kind of human clinical trials. So regulatory practices will come a vital role here. The failure to obtain the regulatory approval for clinical trials may be attributed to limited in vitro and in vivo data, and perhaps short-sightedness on the part of inventors in not completely understanding the biological mechanisms of the regions in which the invention will be applicable. And hence, you have to have a thorough knowledge on how exactly the clinical trials will be carried forward. Later, it is very important that our novel inventions must be patented to protect the intellectual property of the inventors. And hence, the business model comes into play here. The intellectual property refers to any idea born of the intellectual creative efforts of an individual or as a team. So it can be owned, licensed, or transferred. So here I would like to showcase few of our studies which has been done in our own department, in Department of Prosthodontics. This was a preliminary screening study where we could utilize two important herbs, that is Oxum santum, that is Tulsi, and Salim sir has already said that he has done extensive research on that as well. And this was our preliminary screening study, and Punica granatum, which is a pomegranate peel extracts, which was actually utilized as denture cleansers for patients who were given the first time denture wearers. And we could notice that Tulsi preparation was having a better beneficial effect when compared to Punica granatum. This was all preliminary screening studies, and you can actually see the amount of inhibition from day 1 to day 7 in relation to the after denture insertion in relation to Punica granatum and in relation to the Oxum santum. So Oxum santum stood better when compared to Punica granatum. Later, we have also concentrated on developing and evaluating a polyherbal effervescent denture cleansing tablet. With all due respect to Sunil sir, we have also targeted development of a polyherbal denture cleansing tablet as well. And of course, Sunil sir has depicted very beautifully in his densive denture cleansing tablet, which has got a large amount of allopathic drugs. But here we have purely concentrated on combining the effect of two herbs, which is nothing but Triphylla and nutmeg. And we could see that in combination, Triphylla and nutmeg were very beneficial in inhibiting two important microorganisms, that is Strep mutans and Candida albicans. So these were some of the in vitro studies already carried forward, and this was the formulation chart which we have designed. And you can actually see that it is showing a good inhibitory effect in relation to minimal inhibitory concentration at as low as 2.5 microgram per ml. So you can actually see that the percentage of inhibition for both Strep mutans and Candida albicans, it was actually beneficial. We have also carried forward with the pre-compression, post-compression studies, of course, compatibility studies as well. And to our credit, we do also have patent published last year in 2021 on this stable denture cleansing effervescent tablet. So we've also carried forward in the development and evaluation of clove and cinnamon extract loaded emulgel for antifungal activity in case of denture stomatitis, as I was discussing in relation to the denture biofilm. So here again, we concentrated on herbal combinations, and we could see in the development of emulgel when combined with clove and cinnamon, having cinnamaldehyde and clove extract, that is mainly the eugenol, having beneficial effect in targeting not only the mucosal biofilm, but also the denture biofilm. And we were lucky enough to do the toxicity studies as per OECD guidelines, and we could actually validate that it was safe and non-toxic at as less as 0.3 milligram per ml. So the kind of extracts which we have utilized is well within the limits, and it is well within the micrograms per ml. We have also conducted the randomized clinical trials following the good clinical practices, having all the regulatory approval, and we could see that the patient's compliance was also better when compared with synthetic drug. We have also compared with synthetic gel by conducting the randomized clinical trial, and we have got better compliance on this emulgel. And hence we could publish our patent And I'm happy to share the letter of intent from Group Pharma, where we have had the industrial collaboration. And in due course of time, we will have our ML gel available in the market to benefit the needy at large. So thank you so much, Sunil sir, again. So having seen all this, it looks very neat and nice that all research could be done this way. It is very important to budget our time, and it requires large amount of funding. So without funds, it's very difficult for us to do any kind of further research, be it university funding or external funding. So hence, budgeting our time is very crucial, and having solid partnerships is very important for innovating any kind of project. We need to communicate, and here, the major effort help goes for 80% in planning of the project and 20% writing the proposal. And hence, I would request everybody to go ahead and put for external funding, so and never lose the interest of writing your proposal and asking for external fundings, either in case of university fundings or external fundings. To conclude, herbal medicines has come a long way since then, and newer definitions are being offered with every passing year to account for novel advances in clinical medicine. A deep understanding of the product development process is mandatory when conceptualizing novel ideas. It is imperative that the end goal of clinical translation be born in the minds of researchers when they contemplate the materials, designs, and fabrication methods for novel inventions. So what is the golden rule? Interdisciplinary collaboration. Interdisciplinary collaboration is a critical pathway to identifying issues with current technologies and for translating academic research to clinical practice. Here, I would like to share a very important thing, that here in our college, JSS Dental College and Hospital, most of the researchers, our faculty members, are driving really hard and actively involved in developing large amount of products, especially in case of targeting dental diseases, and most of them are already in the pipeline. Our faculty members are striving really hard in guiding not only themselves, but also the students to enrich their interest in developing phytomedicines. With this, I would like to express my gratitude to Almighty, my teachers, mentors, and my dear friends for being always there with me throughout my research project. I also would like to thank PA College of Pharmacy, Salim sir, and Sunil sir from Group Pharmaceuticals for giving me this platform to share my little bit of knowledge on this alluring topic. Thank you one and all. At the end, I would also like to congratulate all the participants, all the winners who have attended this webinar. I hope it is educative. Thank you so much.
Madam, please accept my standing ovation for all
Thank you so much, sir. Please,
fantastic work which has been done.
Thank you so much, sir. Thank you, sir.
Amazing. And your rendition was so flawless. Your tone of voice was also very appealing. It was so quiet, and it was a very, very good presentation.
Thank you.
From
Thank
the
you so
voice
much,
quality and content also. It was very guiding to all the students.
Thank you
And
so
of course, the dentists who have come and many other, it's a mixed crowd you are having here.
Thank you, sir.
And there are a lot of congratulations and thanks pouring in the chat box. So that is a credit to you.
Thank you,
Madam, I will start off by asking a question.
Yes,
and then I'll ask Dr. Salimullah to take over on the question also.
Yes,
and
sir.
Dr. Kaushik also can contribute. So my interest basically is I want to know from you, what is the importance of saliva as a immunity fluid? Can you elaborate some points on that?
Sure, sir. Actually, there are a lot of research happening in our department, mainly targeting xerostomia and hyposalivation also. We do have my own colleague, Dr. Nandita Madam, is actually striving hard on this aspect as well. And saliva is mainly a diagnostic fluid. So the presence and absence will have both positive and negative benefits to the patients. So when you think of positive benefits, the mere presence of large amount of antimicrobials present within the saliva has large amount of antibacterial activities and antimicrobial activities per se. But once there is no saliva as a result of systemic complications within the patients and large amount of medication consumption, the saliva would actually reduce. So we can actually think of herbs in case of phytomedicines, which could stimulate the production of saliva per se. And that would internally help our patients also.
Very
so
interesting.
That would be another area of interest as well.
Yeah, and a lot of ladies are also there, girls and ladies. They are very inspired by your presence and presentation. Dr. Salim sir, please.
Yeah, thank you, madam. It was a wonderful presentation from your side. And you have covered a lot, and you have portrayed your research. Wonderful. Thank you so much for accepting and enlightening our students and our faculty.
Thank you, sir.
And it is always an inspiration to have active research on a board and tell all these things that will, there is one saying from horse's mouth. So it's like a horse's mouth when an active researcher himself or herself come and tell these things, and that will go into the people's mind easily, rather some inactive person coming and telling all these things. First of all, I would like to congratulate you for having letter of intent from Group Pharma, and also for having a patent on your research. It's a wonderful achievement to have. Actually, as you rightly said, it's research is not just doing something and publishing a paper and throwing somewhere. Research is an innovative research is something which should go to the public. It should, from lab to the industry, it should go, and it should reach to the public. Then only the research gains its importance and its meaning, actually. So whatever research we do. So congratulations is a very good topic. I mean, a very good thing that you are doing. And you said something about the selection of herbal drugs. That is very crucial.
Yes, sir.
And not only selection, but also identification of the plant is pretty much important in herbal drugs. Once what happened, I will give one example. Once in one of the research students, she did a complete work on wound healing activity of one of the herbs. And she did work on some plant name. And at the end, when she was writing conclusion, it was dawned to her. She came to know that the plant what she selected was not the plant what she has actually mentioned in the thesis.
Yes,
but it is something else. Tridax procumbens she was doing. The name she had given was something different. So identification, botanical identification is very, very important in herbal product, because they have very, very similar drugs, which are maybe activity wise they are completely different. Okay. Their botanical appearance, pharmacology, morphological appearance and color of the flower, everything looks same, but they may be different plants. So a taxonomist, a botanist must play an important role in the selection of, in the identification of medicinal plant.
Very true, sir.
Coming to selection, you rightly said that ethnopharmacological approach is the best approach because it gives a reverse engineering rather than simply assuming things and going by randomized selection, or by, even for that matter, even chemosystematic also sometimes may fail, but most of the time ethnobotanical and ethnopharmacological approaches will not give you so many failures as that of others. Okay, and randomized, like there was one anti-cancer study long time back in US. What they did, they simply picked whatever comes to their hand. Okay, this plant, that plant, that plant, and they did lot of high throughput screening for herbal drugs. But out of millions of extracts, they could not get even tens of extract which was showing hits. So randomization is mostly ruled out way of selection. Chemosystematics is okay, it's good, but ethnopharmacological is the best way to go forward in selection of herbal drugs.
Yes.
Biofilm formation, as you said, yes, your Asimum sanctum,
Yes, sir.
Asimum basilicum, they have a very good activity in biofilm prevention of biofilm formation.
Yes, sir.
We have done the work, and we also did work on fresh extract of ginger and garlic, but both of them had a very bad experience with the patients because of their their odor. So we have to consider many things in herbal drugs. It's not just the activity, but also the taste, compatibility. Palatability,
Compliance.
especially dental care. Palatability makes a lot of difference.
Yes, yes.
That's very important. And yeah, a lot of work. Thank you so much.
Thank you so much, sir.
For the excellent presentation. As Sunil sir
Thank
was
you.
saying, flawless and continuous presentation, and your tone was excellent. There was no disturbance any point of time. Okay, sometimes I envy people who speak so fluently, like our
Thank you,
Sunil
sir.
sir
Thank
also speaks so fluently, but I cannot do that. Thank you so much. Kaushik sir would like to add something.
Kaushik sir, there are some Q&A. You please take that.
Ma'am, I think one of the questions that Roshan is asking is how over salivation can be harmful.
How?
Over salivation.
So over salivation, what happens if you're targeting any kind of drugs and if there is no retention, mucosal retention is what we are actually thinking of whenever we are developing any phytomedicine. So over salivation, what happens is it results in dissolution effect. So that time you need to improvise on your fabrication and characterization of your drug developed. So it is not a hard and fast rule that the patient has some certain disease, but patient per se, inherited that patient has some amount of salivation. So in such conditions, maybe you'll have to vary the concentration, or you need to characterize your developed drug, and then you'll have to carry forward some pilot studies, and then you have to take care of it.
So there are some diseases where there is over salivation, madam?
Sir?
Are there any diseases with over salivation?
Not exactly, sir. Not diseases. You can actually think of hyposalivation, but over salivation, I don't think so. Mainly medications mainly results in hyposalivation, but no hyposalivation.
Maybe that Roshan's question was in normal condition. Is it harmful to have over salivation?
No, not really, sir. Not really. But if you're targeting or developing certain herbal drug in relation to oral cavity, and its retention would be compromised because of dissolution effect of saliva itself. So in those conditions, there is stability studies and release studies, all that you're supposed to take care, and then you have to come up with a newer product.
Yes.
Dr. Kaushik, there's one more question.
Yeah, ma'am, there's one more question from Padma Shri.
Yes,
she's asking how to avoid the ulcers and cracking on the tongue due to medication of heart. Maybe that, contraindications, that's what she's trying to ask.
Some side effect of some medication.
Side effects.
Yes.
Side effects. Like how to avoid ulcers and cracking on the tongue due to medications, other medications.
Yes, this question is not actually apt to my presentation, in fact. But then maybe a B complex supplements would be of help to her, and she would actually benefit if she's getting any consultations actually. And intraoral observation would give us a better clear-cut picture to guide her better. Otherwise, it would not be able to self-medicate, because the deductive approach is almost always common among all of us. It is safe for somebody, you also start using it. That should not be the way. It is always better to go and approach a clinician, showcase the symptoms, and then take the medication. That is what I would actually drive everybody to do so. So maybe a B complex supplements would take care of that, sir.
What happens when people come to know doctor is speaking?
Yes,
so when Dr. Meenakshi is speaking, some like these questions will come naturally.
Oral diagnosis.
Very good question. Yeah, very good question. So nice one. And I don't think there are any other questions. Can you see any? There are no other questions, right, Dr.
No, sir. No, sir. No, sir. Yes.
Questions.
Yeah, I think I'll ask one last question.
Please,
Madam, in the denture issue,
yes,
do you see there is an advantage for the herbal type of formulations to manage the denture hygiene and denture complications vis-a-vis the synthetic chemical based? Do you have any viewpoint on that?
Definitely, sir, because we have done this randomized clinical trial on our own product, and we have compared it with the synthetic gel itself. So the major disadvantage of having a synthetic drug is their bitter taste and developing resistance to it, because whatever drug you give has to be used for a period of 21 days for complete remission of any kind of oral ulceration within the oral cavity. So herbs by itself has got better compliance when it comes to patients. So patients accepting is faster, and taste acceptability is another important thing, as sir mentioned, because oral cavity palatability is one important glitch there when you go compare it with synthetic drug. So it will not get really accepted by patients, and when you tell that you're using your clove and cinnamon, and if you're telling this in your local language that these are commonly used in your day-to-day life, the acceptability is better. So that is the reason why I highlighted on this ethno-guided and ethnopharmacological approach. Rather than telling that these are the herbs, though many other herbs would have more beneficial effect, but compliance gaining is a glitch there.
Very intelligent. Madam, Iftekhar has an interesting question. Is there a difference in the results based on the type of saliva, that is serous saliva, mucus saliva? So what is the
Definitely, sir, because we actually opt for sero-mucus combination, neither too very serous diluent effect on the drug or too very mucus, which prevents the adherence of the drug itself. So a combination of it would be of benefit, but again, still a little bit of research needs to be carried forward on those aspects as well.
Oh, good question, Iftekhar. And
Madam,
there is a question
I have one question, sir.
Yes. Yes, yes.
Madam, you have worked with so many herbs. Did you get any issue with making it, formulating it about its solubility issues?
Yes, sir. Initially we did have
applying and all.
So quality care of materials is very important here. I definitely would like to highlight on that. So whenever you're selecting any herbs, and the quality care, good clinical collecting practices, good agricultural practices, depending on your geographical location. So all that will come into play, sir. So definitely initially we had this glitch, and a lot of preliminary studies was done, and then only we ended up, sir.
No, if you are taking an extract and if you are converting into a gel, or if you are converting into a paste,
yes,
was it a bottleneck?
Initially, yes, that glitch was there because I was quite new to the interdisciplinary collaboration and doing it. So I had to do a lot of literature search myself, and my area of interest is mainly dried extracts rather than the wet samples. So that was easy to handle for us when compared to the wet samples. So I have no experience on handling the wet samples, sir. I have always handled dried samples, dried extracts, and that was beneficial in developing a product.
So if you are applying, if you are applying on your dental surfaces and all. One is hypersalivation.
Yes,
second one is the patient's sense that is there, and with the tongue, that all the problem. So the residence of medicine on the spot will be very, very short.
Very short, yes, sir. So you need to select certain polymers, and we have selected a biopolymer in the form of almond gum here again, where the retention capacity was enhanced, mucosal retention in relation to the oral cavity, which was evaluated through France diffusion apparatus to see the release rate. So there was continuous release for around 180 minutes, and then there was diluent effect. And since we have targeted on the Canada-associated denture stomatitis, or it could be used for any ulcers as well. So what we usually ask the patient is to apply every 4 hours. Normally, the recommended dosage is applying 3 hours or 3 times a day. So you can actually think of using a natural polymer in that way and increase the retention capacity within the oral cavity, since the oral cavity, as I mentioned, is a dynamic environment, and your tongue movements, your cheek movements, your mastication, everything would hamper the concentration of the drug within the oral cavity. So what we recommended patients is to use for 4 hours when they are not active, and again continue after having their food and in the night. So 3 times was recommended, and the results were beneficial when compared to allopathic drugs. We could have the remission of the stomatitis within 21 days when compared to allopathic drugs, which was not inducing any kind of remission after 21 days also. So in that way, our drug was beneficial, sir.
So you were using aqueous extract or alcoholic extract?
Aqueous. Yes. Because
Aqueous is
alcohol
better.
itself would have
Yeah.
so we
Correct,
wanted to go for aqueous extract itself.
Aqueous extract, yes. Yeah.
Fantastic, ma'am. Actually, what you have brought out is the importance of interdisciplinary approach.
Yes.
So all these pharmacy guys, everybody will be involved in such an interdisciplinary approach. Very interesting, ma'am. And so obviously water extract is always preferable. Am I right?
Yes.
Dr. Rekha Shetty is also asking
Yes,
that
sir.
question.
Yes, sir.
Yes.
And,
Aqueous is better in case of formulation, application, and even this harmfulness in all aqueous is always better.
And potentiating your own drug would be better in aqueous, sir, because alcohol itself would have some inhibitory effect. So you cannot substantiate that it is because of your drug the effect has been there, or it is because of the alcohol itself.
Yeah, very important point.
Yes, sir.
Exactly. And madam, when these herbal drugs are taken for dental problems, for oral local application like mouth or tongue, Roshan wants to know whether there are any contraindications.
Maybe I should also think on it, sir. And no such contraindications per se, but of course, if you have done your literature search on the drug by itself and systemic involvement or systemic ingestion would not bring about any systemic complications, then it is good to go. You don't have to worry at all. And well within the dosage, with minimal concentrations, even ingested, not inducing any systemic effects, should not be a problem, sir.
Exactly.
So in general, you cannot say contraindication for all herbal drugs. If you have a particular drug, then we can say contraindication.
Right, sir. Right, sir. So safe and natural cannot be taken as a synonym, sir. Safe, natural cannot be a synonym. So a lot of pilot studies needs to be done, and conclusive results has to be drawn before you could actually say that it is not being systemically harmful.
No, you have told a very important point, because this buccal environment itself is a source of absorption. We have sublingual tablets and all that. Yes. So you said that the drug, it can get into the systemic circulation and it will bypass the liver here. Right. No first pass metabolism. Straight away it will go into the systemic circulation. Right. Very important point. If some poisonous metabolite or something, plant metabolite is there, it is going to go straight away. I mean, possibility is there. Very important point raised by Mr. Roshan. Very good. And madam, last question I'll ask, it is from Aisha Hilan, because she is repeatedly asking, what may be the challenges that will be faced by botanicals over synthetic, and how can we increase the acceptance among people?
So as I have already highlighted, the acceptance again done, you can actually do the studies itself by giving it to patients and taking their feedback. So some testimonials would be of help to you guys, that whatever feedback you get from the patients, that itself would be a helping hand for further innovation and further improvisation of any product. So I think I would end that way, sir.
Yeah, that is the ethnopharmacological approach itself will sort out all those problems. That is what madam is reiterating. So that is the importance of ethnopharmacology. It's come culturally for such usage patterns, and scientifically we are using it. And can herbal medicines cause any alteration in taste, madam, as a side effect? Have you noticed?
As per my knowledge, with whatever little bit of research what I have carried forwarded, I have not seen any kind of feedback that way. But maybe that also requires a little bit of research on that part as well before you could select and you could develop a product, because it is again targeted in relation to oral cavity per se.
So very valid.
If you are using strong tannins, there are phytoconstituents called tannins.
Right.
Tannins have the capacity to precipitate the surface protein in your tongue and mouth. If you are using strong tannins, then your taste will alter.
Okay, sir.
Super. Exactly. Yeah. Thank you so much. Now I think we'll have to come to the close. All good things have to come to an end. So now I'm offering the platform to Dr. Kaushik Devaraju, President KRPA.
First of all, ma'am, I think in the last couple of slides, I think you rightly mentioned, budget your time, interdisciplinary collaboration are those things that's required. I would just like to give an example, ma'am. I think, in 2015 or 2016, a company by name Attrimet Life Science, they applied for a grant through Elevate Karnataka.
Okay.
And they have grown to such a level, you also mentioned that, should always apply for grants, apply for funds, ask for a funds. I think if there is a right research, today we could see that, their advertisement coming in all the news channels, that's how the company will evolve over a period of time, and the proper research is there. I think we also get excited when people like you come and share the knowledge. That is what the platform is about, and what is the main intention of conducting this type of webinar. I think by this, I think, Sunil sir, I think you would agree with this. I've been observing Madam from, I think we share the same camp. I also did my Masters and PhD from JSS College of Pharmacy. Okay. I've been seeing you, you're always smiling, always proactive. Sir, you can say that, sir is a perfect example for the University of California study also that you mentioned in the beginning. Thank you very much, ma'am.
Thank you, ma'am.
Thanks for your sharing your knowledge and valuable time also. And coming to our Dr. Salimullah sir, I think we also are happy to collaborate with PA College of Pharmacy. There are so much of positive things that are coming out from the college. You also mentioned that, this is the first batch that is students are coming out from B.Pharm. We'll be very much happy to seeing them, success in their life and doing well to contribute to the society also. That is the main agenda of one of your institution also. So thank you very much for having this webinar, sir. And you also said that, this is also conducted in collaboration with Ethnopharmacology. I also aware that, in March or April, there is a conference that is conducting by Ethnopharmacology in JSSAHER, I believe.
Yes.
So hoping to see you there, sir. And I would also like to thank Sunil Suplinkar, sir, who is always smiling and, one man, always say the captain of the ship, handling so nicely. And we don't envy you, sir. We always request you to be with us and take you as our association forward also. Thank you. By seeing you guys, we get a lot of energy, and that is what we look forward also. And also like to thank the staff of PA College of Pharmacy, the students who have joined. And we also like to thank Sunil Attawar sir, who is the MD of Guru Pharma, for sharing this webinar and platform for us from very long time. And thank you one and all. And I also see that, to all the attendees, I think there are a lot of files that has been shared in the file section. You can download it and also make the use of it. Thank you one and all. Over to Sunil sir.
Thank you very, very much. It was an awesome, beautiful Saturday morning that we have spent. Thank you so much. Fantastic.
Thank you so much.
I take the permission of Dr. Salimullah, Dr. Kaushik, Dr. Meenakshi madam. Can I close the webinar?
Yes, sir. Thank you so much, sir. Thank you so much. Thank you, sir.
Thank you so much.